Hi, this is Carol Winchester, and welcome to the Sarasota, Florida at-home edition of DMS Cares. I'm over 60 years old, so I need to socially isolate, just like many of you or many of your patients are doing. And as such, it's interesting the questions that were being asked this week. Why am I so scared? And why do I sometimes feel like I can't swallow with my increase in anxiety? Social isolation in the uncertain terms that we're in right now, fear of leaving the house, not knowing when this is going to be over. Am I going to get sick? Each day you wake up wondering if this is going to be the day. The amount of anxiety that this is causing, especially to people over 60 or those with compromised immune systems, is staggering. In dysphagia, because it's a complex system and involves 5 things. We've talked about this in previous segments where you have to be able to chew muscularly and push the food back and push it down. Respiratorily, you have to be able to hold your breath. Neurologically, you have to feel that the food or liquid is in your throat to be swallowed. Cognitively, your brain has to be able to work with your body in order to be able to get that food all the way down and recognize that things have to happen. And gastrointestinally, it's a unidirectional system where it's supposed to just go down and stay down. But a lot of us with reflux, that's not the case. Anxiety increases gastrointestinal issues with reflux, maybe the foods that we're eating. So we're in a quagmire of complications, and a lot of it being driven by anxiety. So what can we do? Well, I talk to a lot of patients. You know, I've been a speech pathologist for 40 years now, and I had a lot of experience in not only diagnosing and treating dysphagia, but also operationalizing it for the individual in their individual circumstances. And these are some of the things that my patients have found to be helpful. One is breathing. You know, if you have dysphagia and you're having trouble with the coordination of the breath hold and the swallow, there are things you can do. We talked about going slower and really focusing on where you are in the swallow and getting the food down safely. But when you have anxiety, that breathing can be interrupted, if you will, because anxiety causes you to tighten up everywhere. And sometimes you can feel very constricted. It's very similar to the patients that have COPD or CHF, congestive heart failure, where they feel like they can't get a breath. So there are some things that you can do that my patients have found ease their symptoms somewhat. First of all, we talked about putting your arms on the table in order to lengthen the dimension of the lungs, just helping it have room to expand so you're not all scrunched up. That can help, but the perception of getting air into your lungs is also very important. You can do simple things like make a circle with your hand and breathe through that. What that's doing is it's bringing the air in through a constricted space, which helps you feel, because it is a perception, like you're getting more air. The toilet paper rolls that you have in your house, which are very precious right now with this crisis. If you take one of these and you can wrap saran wrap around it or whatever, and you could put that up in front of your mouth to help bring the air in as well. And it just helps you feel like you're getting the air in a more efficient manner. You can even do things like use a funnel. You can use your hands. So try to just, take a moment, bring the air in, sit in a way that it lengthens your lungs and let you feel as if you don't have what's called air hunger, because that's what it is that you're feeling. The next thing you can do is look at your environment. One of the things that we've got to do nowadays with what's going on is we've got to try to stay calm, especially while we're eating. Turn the news off. Don't eat to the news. If you have a favorite show that you DVR'd, maybe put that on. If you watch soap operas, ladies, like Days of Our Lives, like I do, watch it while you're eating. It's just simple, mind-numbing, takes your mind off everything else that's going on. And what that does is that just allows your body to relax. And you want it to relax because you want these 5 systems to be able to work together. Also, where you eat. If you can eat at a table and put your arms up, if that helps, that's great. If you want to eat at the couch, if you want to go sit out on your porch and just listen to the birds or watch the sunset, find something that helps you to just relax and to just feel calm or get a little bit of change of pace. The next thing you can do is your food choices. We know about the texture. Your speech language pathologist has done a diagnostic on you, has recommended a certain texture. In these times, one of the things we will be doing in the next couple shows is looking in your pantry and seeing how can you make foods out of textures that you have on hand. With availability to going to the grocery store being limited right now, we're hoping that will be handy for you. But think about something that you like. And something that is kind of your go-to, maybe you don't feel good food. Maybe it can be something made with a rice and a sauce, whether it be, a cream of mushroom soup or a tomato soup or a cheesy or something that makes it stick together and easier to swallow. That is a taste that you like, maybe something that brings you back to your childhood. The other thing you can do is that think about the things that you know for sure don't give you a problem. For example, we know that applesauce, there have been so many research studies done that show that it is the easiest consistency for someone that wants to have or needs to have a puree diet to swallow. Not the runny applesauce, but a nice smooth applesauce. Maybe you like it. Maybe you know that it's easy to swallow. Maybe there's a pudding that your speech pathologist has said would be good for you. Find that thing that you know is good for you. And even if you have to eat it for more than one meal, if you're having a particularly anxious day, then do that. It's okay. This is not a time to think about calories. Obviously, if you're on a restricted diet, if you're a diabetic, or if you have to have a reduced salt intake, do whatever your doctor says there. Positioning. As I mentioned, putting your arms on the table is always a good thing in order to lengthen, especially if you're anxious. It just helps. Sometimes you can put your arms out this way. But one of the things you might want to consider, whether you're sitting on the couch and you've got your arms on pillows, or you're sitting at the counter, or you're sitting at the table, think about leaning forward a little bit. Leaning forward a little bit just sort of helps align your body. And when you're anxious, it can help you to bring that air in, to feel secure in your environment, and know that you are actively doing something to try to help those 5 systems work together. On the inside, we could get technical about what it does with your epiglottis or what it does with your muscles. But we find, especially if you're a Parkinson's patient, or if you have a neurological disease, or even post-stroke, sometimes leaning forward a little bit can really help. Try those positions for yourself. The other thing you can do, and this is recommended by psychologists and psychiatrists, and I've had many of my patients say that they feel less anxious with the fan going, whether it's your ceiling fan, whether you have a fan over here, bringing air your way, kind of just washing over you and relaxing you. So while you're eating, get the fan going. That can help you with, again, what you may perceive as that air hunger, or what you may perceive as the inability to coordinate the swallow. Because what happens sometimes, and I know we've all done this when we've been in a fearful situation, is that all of a sudden you just feel like things aren't going to move, and maybe it even takes your breath away for a second. That level of anxiety just tells you, stop, let's change the subject, let's do something in order to get that to go away. And one of the things you can do is to reach out to someone, do a FaceTime, sit and eat and have your iPad here and call your kids, have them join you for dinner, eat dinner together from your different locations, because just touching base with someone, having someone be there with you, even if at a distance, is going to help lower that anxiety. The other thing that you can do is reach out to your speech pathologist, reach out to someone to just review what it is that you're doing. This is why we've put our toll-free number 833-Dysphagia into place. We know that so many patients are being sent home. So many people are not leaving their house to go to their appointments. They're not getting the therapy that they need. We want to make sure we answer your questions. We want to make sure that we can help you find practical solutions to the issues that you have going on during this very uncertain time. We call it dysphagia management for a reason. Having a diagnosis of dysphagia and getting the food texture right is one piece of the large puzzle. The rest, as I mentioned earlier, is operationalizing this into your specific life, into your circumstance, in your diagnosis. So send your questions to us. We're here to help you. 833-Dysphagia. And our response to this unprecedented situation that we're all in is to be here to help, because we know that that makes a difference. So let's all stay safe together. Let's all help reduce our anxiety together, because we're here for you, because we're DMS and we care. This is Carol Winchester. Thank you.